I don't think it was too early. One of the key concerns in the Danish strategy is whether restrictions create pandemic fatigue and how they impact well-being. So in that sense, the restrictions were lifted in order to buffer against fatigue, and it was done as an experiment to see how far could we go without restrictions. And especially now with Omicron, it's clear that restrictions are needed again.
So on that note, how concerning is the spread of the Omicron variant there, not just from health authorities, but from the general public?
So both the health authorities and the general public are, according to our data, very concerned about the current epidemic situation. We have very good testing and sequencing capacity here in Denmark, so we can really follow the spread. But because of all the uncertainties, it is very unclear what will actually happen, how big the wave will be.
Yeah, and so now we are seeing that the State Serum Institute saying that next month or so will be the hardest of the pandemic. From what you can observe, can the health system there cope?
Well, the coping capacity of the health system is somewhat flexible. So if the worst scenarios that they actually will be realized, it means that a lot of other kinds of activities will be cancelled or postponed. So in that sense, the health system will cope, but it will definitely come at some costs.
Look, is there a sense that perhaps some sort of comfort based on the general consensus? We now know that Omicron is somewhat less severe than Delta, especially for those who have been fully vaccinated.
There are some comforting facts with regards to Omicron, but also the Danish strategy have been to roll out booster vaccines very quickly. So already a third of the Danish population has been vaccinated with a booster vaccine, and that does create a lot of ability to cope with the Omicron wave. But at the same time, the danger with Omicron is that even though it might be milder, then the sheer number of infected can still overwhelm the hospital system.
Yeah, as I mentioned in my introduction, there are bans on large gatherings and restricted hours for bars and restaurants. Is there a sense that these current measures will help keep case numbers under control, or could there be more stricter measures as we come towards Christmas?
I think that there may come stricter measures. So this weekend, the Danish epidemiological authorities released a report that predicted between 9,000 and 45,000 cases on Christmas Eve. All of those case numbers are high for Danish standards, but of course it makes a huge difference whether we are in the lower end or the upper end. So if there were scenarios that they actually come true, then I think we will see within some days stricter measures being used.
Michael, I want to go into a paper that you recently published indicating that the pandemic has eroded trust between the citizens and government institutions. How is this being manifested in Denmark?
So we are seeing in Denmark demonstrations against restrictions, but we also not only see it in Denmark, we are seeing it across Europe with very violent protests also against mandatory vaccines, and one of the dangers in such a pandemic is to exclusively focus on the health side of things, because a pandemic is really a crisis that affects every part of society, and people's well-being will be adversely affected. People's sense of control will be adversely affected, and what we see is that decreases trust in the authorities. And the problem with that is that trust in the authorities is one of the most important features of actually being able to handle the epidemic. So the longer the crisis lasts, the more difficult it will actually be to manage it.
And it's such a big dilemma, isn't it? There is this issue of how much the government should be doing versus personal responsibility. Did your study focus on that as well?
The study did not specifically focus on that dilemma, but it is a dilemma that also have been central to the Danish strategy, and that I've been involved in bringing to the forefront as an advisor of the Danish government. That you really need to balance a lot of different considerations. One is to public health. The other is to the economic activity of society, but also to the well-being of the public and the basic rights of freedom that you have as a citizen in a democratic society. And it's really important to try to find the right balance and to justify the balance that you make to the public.
And so this erosion of trust that you've written about, how is that impacting on the government's efforts and the health authorities to control COVID and to reopen ultimately?
So the problem is that when trust is being eroded, people are less likely to comply with the recommendations of the authorities, and they are less likely to make these voluntary behavior changes. So there is this danger of creating a vicious spiral where the sort of because the authorities, they fear that people will not actually comply, they use more strict restrictions, which will only create more fatigue and undermine trust even more. So it's extremely important to get out of that type of vicious spiral. And the only way you can do that as an authority, as a government, is to communicate clearly and constantly focus on the people's acceptance of the measures that you're putting in place.
Yeah, Michael Bang Petersen, really good to get your thoughts this evening. Thanks very much.
Thank you.